You're very welcome back to Ireland AM. From period trackers to breastfeeding monitors, a new report from the Health Innovation Hub Ireland has called for the government to prioritise the development of FemTech here in Ireland.
Here to discuss is the founder of FemTech Ireland, Dr. Tanya Mulcahy. Thanks for joining us this morning, Tanya. Great to have you on. So I find this very exciting. I mean, women's health needs so much in terms of research and funding, and it's great to hear that we might finally be catching on. But this term specifically, FemTech, what does that relate to?
So you've heard about fintech, services, technology for the financial sector. You've heard about sort of green tech. This is about women. So it's technology for women. But in this context, it's used about in terms of technology that addresses women's health issues. So it's a term that's used globally. There's a bit of a revolution happening in that space, and it's really exciting.
Absolutely. Because when you think about what's happened, and I only realised recently when it comes to clinical trials, studies, etc., they've all been skewed towards men. So a lot of the research we have on from medicines to technology to even seatbelts in cars.
Absolutely.
The crash test dummies were all men. So it's about time this turned on its head, because 50% of the population is women and we're not really catered for at all.
Well, I can't agree with you more. That's why we're doing this work.
Yeah.
But you're right. And the reason for that really is that you've all heard of the thalidomide cases. Yeah. So any new products or services need to go through clinical trials. Because that happened in the 1970s, where women they were developing a drug for morning sickness. Unfortunately, the women that took that drug, many of the children ended up with limb deformities. And as a result, they said, OK, we're going to exclude women of childbearing age from clinical trials, which meant none of the companies, none of the tech companies, none of the drug companies developed products for women because they couldn't get them approved and tested. That's changed. And because of that change, and because women are actually more vocal now and looking for solutions, we're on a new wave. We're developing these new technologies. There's an opportunity for business, but there's a really good opportunity for health as well.
And this industry, the femtech industry, is projected to grow by 84 billion by 2035, Tanya. What has led to this recent surge, you think? Is it the recent research?
Yeah, so I think there's a couple of things. I mean, one of the things is you rarely find a blank slate to develop new products and technologies. And all of a sudden, we're doing a lot more research into the difference between men and women. We're figuring out that there are lots of conditions. Well, we know there are lots of conditions that affect women only, but there are conditions that affect women differently as well. So it's amazing to see that, 3/4 of people with Alzheimer's and dementia are women, like just 3/4 of them. That's an awful lot of the people with that condition. 80% of people with neurological conditions are women. Migraines affect women 3 to 1. So the ratios of those kind of things, we're looking at that and saying, why is that happening in women differently to men? And then can we learn from that to develop new solutions? So there's so much we can learn in that space. The other thing is women are talking more about things. So we're talking about menstrual cycles. We're talking about volumes of blood. We're talking about what's normal. Why are some people have fertility issues and others don't? Why does IVF work for some people and not for others? Mental health. You've had people on here talking about endometriosis. Huge condition. I mean, it shocked me to find out that 1 in 9 people have this. It takes 9 years to diagnose. We need better diagnosis technology.
More money's gone into research for erectile dysfunction than it has for endometriosis, for God's sake.
But it's up to us now to take a stand now and say more money for research, more money to develop these technologies. Investors, I'm calling on all those women out there with lots of money in their bank accounts, huge opportunity to invest in 51% of the population. But not only that, 51% of the population will impact 100% of the population.
Because I think sometimes we're just used to being told being a woman is pain. From the minute we start menstruating.
Get over it.
Get over it, because that's just life. You're supposed to be like, I don't know about you, but I remember like being in bed for days every month in absolute agony. So that's just what happens. You're a woman, suck it up. And from that to fertility issues, to menopause, to perimenopause, which people weren't talking about for ages, and bone density and all these sort of things. We were kind of just, you're a woman, you have to suck it up.
Yeah, I mean, in fairness, I suppose, think about it. Because of the way our hormones act, our bones start to disintegrate much earlier than they do for men. We have to live a lot of our lives in ill health, and we need to solve those problems. So it's really a health imperative, but also there's a huge opportunity.
What are the most innovative things that are happening at the moment in terms of femtech?
So I'm going to talk about Irish companies, because I'm really supportive of Irish companies, and that's what we do, support Irish startups. And there are a lot of them, about 40 companies we've been working with, a lot of them funded by the government, which is brilliant. Enterprise Ireland fund a lot of these. There's lots of supports. So we're working with one company, Nua Surgical. They're developing a device, a medical device, that makes C-sections safer. So it pulls back the abdomen so the doctors can go in and take out the babies without too many hands going in there. reduce infection rates, make it safer. Brilliant. Another fantastic company, Perry, I don't know if you've heard of them, Identify Her. They've developed a wearable tracker that will sense and track perimenopause symptoms and give you lots of information. So a lot of people go in still, and I've heard it from GPs as well, I don't know if they're in perimenopause yet. Like, could be other stuff.
A blood test won't do it. You need
a single point blood test just doesn't do it. So this device will track those. And I just noticed today that there's Oprah has put it on her programme there. So it's getting worldwide traction for an Irish product. There's another company, Irish company, Day, smart tampons. So a lot of people, certain percentage of the population won't go get their smear test done for HPV testing. Still really important, cervical cancer. These tampons will allow you to take the sample at home, send it off to the lab and be checked. So these are really smart devices that will actually help women in the future. So many more of them out there.
And it's women-based companies as well. It's women founding these companies, which is also a change because the tech industry has been so tech bro heavy, obviously.
Yeah. I mean, it makes sense. Most of the people that come into us are women. They want to found a company because they've experienced the symptoms themselves or the conditions themselves. Or it could be their mother, their sister, their aunt, but they've been really impacted by it. So when you know a problem really well, you can develop a solution really well. The best solutions are based on people understanding the problem. So again, opportunity for all those young women out there that are interested in what's their next career opportunity. This is a brilliant field to be working in. We're working with an amazing new researcher who's developing a device that will, if anyone's ever had an IUD inserted, a lot of people find it painful. Yeah. This is a device that will make it nicer. A process that it won't be as painful.
How could it possibly be nice?
Well, can you imagine?
I get knocked out for it.
Can you imagine doing it in a way where it doesn't cause you any discomfort, anxiety or pain?
I think to people that aren't even given a Panadol when they're getting it inserted.
Yeah. So, I mean, this is what we're talking about. So that's a problem.
Yeah.
Now she's coming up with a solution, and this could be a global solution.
Yeah.
Well, Tanya Mulcahy, has been absolutely great chatting to you. Thank you so much for coming and talking to us about that.
That's hope. Lovely to chat
hope for the future.
I read recently, actually, that there's, after how many years, how many decades, they've actually just invented a new speculum.
Yeah, that's
a new speculum.
Yeah, because we never argued about why are you using that device. I always say that about the mammograms. You know, when you come out of a mammogram, you're like, oh my God, that was so painful.
Yeah.
Can we do one where you lie on a desk? Yeah. 2 women developed a bra that you can tighten around your breast, all different shapes and sizes. And it actually will do it.
Sounds great to me.
Yeah.
Thank you so much.
You're very welcome. Lovely to be here.
Now, after the break, we are checking in with your latest sporting stories. We'll see you in a few.